in 2021. Okay, so this talk article talks about CA125 and tumor marker. Okay, so carbohydrate antigen 125. CA125 is nothing but carbohydrate antigen 125. It is an antigen used in the diagnosis of epithelial non-mucinous ovarian cancer. Remember, epithelial but non-mucinous ovarian cancer, CA125 is used in the diagnosis. CA125 may be elevated in many benign and malignant conditions. So, elevated levels require special attention. Okay, normal level of CA125 is less than 35 international units. Okay, so first thing what you should remember is CA125 is used in the diagnosis of epithelial non-mucinous ovarian cancer. Okay, and it is raised in both benign as well as non-benign as well as malignant conditions. We know well that most of the ovarian cancer presentation is late because there is no effective screening. That is why almost 70% of ovarian cancer will present in stage 3 and 4. The CA125 use levels in these patients are generally raised in late disease, but in early disease the level may be normal. This CA125 was first identified by Bast et al. In 1981. Bast and his team isolated murine monoclonal antibody OC125, which recognizes an epitope on a molecule called CA125. So it is named CA125 because it is the 125th antibody produced against the ovarian cancer cell line. Okay, so CA125 is also known as mucin 16 or MUC16 because it is encoded by the MUC16 gene, which is located on chromosome 19. These things are generally not asked in the examination. Okay, but you should know that 70% of the ovarian cancer present late in stage 3 and stage 4, and normal level of CA125 is less than 35 international units per ml. Okay. So CA125 is expressed in tissues which are derived from coelomic epithelium, embryonic coelomic epithelium, and these will include endometrium, Mullerian epithelium, peritoneum, pleura, and pericardium. With these epithelia, CA125 is synthesized by mesothelial cells in response to mechanical stress and inflammation. So two important triggering factors for the production of CA125 from the mesothelial cells, they are mechanical stress and inflammation. So it is produced by the mesothelial cells which are embryonic in origin. Okay, and two important factors, that is mechanical stress and inflammation, are the triggering factors for the production of CA125. Okay, CA125 is and mechanical stress. So CA125 antigen per se by definition is not a tumor marker. Okay, when we say that the tumor marker, generally it is produced by the tumor cells, okay, or cancer cells. However, here it is not produced by the cancer cells. Instead, it is released by the mesothelial cells in response to the mechanical stretch produced by the fluid. Okay, so levels of CA125 in the ascitic fluid correlate with those of the serum levels, and they are higher than those in the blood. This indicates that the antigen originates in the ascitic fluid rather than in the tumor itself. Okay, so this is about the mechanical stress, and second is a inflammation. So CA125 and inflammatory stress. So CA125 may also be released in response to inflammatory stress. This explains why elevated levels of CA125 are seen when there are no signs of serosal effusion, such as patients with subhepatic abscess or well-controlled CHF, where there is no evidence of edema, but still the CA125 levels are raised. Okay, so there are two important factors. One is a mechanical stress and second is inflammatory stress. Okay, again these things are not asked in the examination, but for your understanding point of view, these things are important. CA125 levels are raised in ovarian epithelial cancers, but less commonly seen to be in non-epithelial cancers of the ovary. So what happens in the ovarian cancer and CA125 levels in ovarian cancer? So they are raised in epithelial cancer. In other cancer, not that raised. Okay, stage 1 and occult disease can have normal levels. I mentioned that stage 3, stage 4, 70% patient will present, and in those patients CA125 levels will be raised in if they have the epithelial tumor, and that also non-mucinous. Okay, so raised CA125 levels should trigger referral to cancer center for further management. Okay, CA125 testing and in patient follow-up of ovarian cancer. So not only from diagnostic point of view, it has got an importance from the follow-up of ovarian cancer. CA125 level may also be used to assess the patient's response to chemotherapy and surgical treatment. Okay, if the patient undergoes surgical treatment, in that particular case, the level will fall to less than 50% within next 10 days after surgical resection. Okay, so there is a 50% reduction in the CA125 levels within 10 days after the surgical resection. Post-operative level will correlate with the residual tumor mass. Okay, for patients who have underwent complete remission with chemotherapy treatment, the median time of CA125 normalization is around 1.5 months for those patients who have achieved complete remission. So if they have undergone chemotherapy, if it is a complete remission, in that particular case, in 1.5 months, CA125 level will come to normal. If there is a partial remission or partial response to chemotherapy, it will take 4 months for these patients to this particular level to come to normal. So if you monitor this patient post-operatively or post-chemotherapy, you will come to know what's happening inside. Okay, so whether the patient has achieved complete remission or partial remission, because partial remission patients, it will take 4 months for this level for the normalization. And even if the levels are normal, 40% patients can have microscopy and macroscopic disease if the second look surgery is performed. Okay, so the level is normal. Again, it does not mean that there is no disease. They can have microscopic or macroscopic disease in 40% of patients. Okay. Now, what are the conditions in which CA125 is raised apart from ovarian cancer? So, raised CA125 can be because of physiological causes as well as pathological causes. And what are the physiological conditions? Pregnancy, menstruation, age, etc. These are the physiological conditions in which the CA125 levels will be raised. And pathological conditions can be benign or it can be malignant also. Not only ovarian cancer but other cancer such as endometrial cancer, pancreatic or primary peritoneal cancer, lung cancer, breast cancer, bowel, lymphoma. So these are the various cancers or the malignant conditions in which CA125 levels are raised. Is it clear? Are you getting?
Yes, sir.
Yes, sir. Yes,
So
sir.
it is not only ovarian cancer but other malignant conditions such as pancreatic cancer, primary peritoneal cancer, bowel cancer, okay, breast cancer, etc. These are various cancers in which these levels are raised. And benign conditions can be gynecological origin or they can be non-gynecological origin. Gynecological conditions such as endometriosis, then you can have benign ovarian tumors, or there can be acute salpingitis, chronic salpingitis, uterine fibroids, then pelvic inflammatory disease. In these benign condition also CA125 level will be raised. And non-gynecological conditions like cirrhosis or chronic hepatitis, active hepatitis or acute or chronic pancreatitis, renal failure, interstitial lung disease, heart failure, etc. So these non-gynecological conditions can also raise the CA125. So once CA125 levels are raised, then we have to think of various causes apart from ovarian cancer. There are n number of conditions in which CA125 levels are raised. Okay. So what does the NICE guidelines say? So when we are doing the CA125 testing, what does the NICE guideline recommends? So testing is recommended for all women presenting with symptoms of ovarian cancer, such as if there is a persistent abdominal distension, early satiety, loss of appetite, pelvic or abdominal pain, increased urinary urgency or frequency, unexplained weight loss, fatigue, changes in the bowel habit. In these patients, you have to do CA125 levels. Okay. If the patient CA125 level is greater than 35, in that particular case, we have to suggest abdominal and pelvic ultrasound. Okay, it is indicated. So what does the, so this can be asked as a, what is the next step? A such and such lady comes with these complaints and GP has done this particular investigation. CA125 level is 105. What will be the next step? We have to do the abdomen and pelvic ultrasound. Okay, are you getting it? So the NICE guidelines recommend, so just concentrate on the table. So CA125 testing is advised for all women with red flag symptoms which has got a suspicion of ovarian cancer, especially if the age is 50 years or older. So symptoms will include bloating, early satiety, reduction in appetite, pelvic pain, abdominal pain, increased urinary urgency or frequency. So if these symptoms are present, then we will suggest them abdominal or pelvic ultrasound. Okay. So the take home message is normal CA125 level is considered to be less than 35 international unit per ml. CA125 levels are raised in ovarian epithelial cancer, that too non-mucinous ovarian cancer. Okay. CA125 is synthesized by the mesothelial cells in response to mechanical stress and inflammation. So please concentrate on these particular points because they can be asked as a single based answer question. Serum levels are expected to fall by half within 10 days after surgical resection, and post-operative levels will correlate with the residual tumor mass. Complete remission with chemotherapy treatment, the median time required for CA125 normalization is around 1.5 months or 1.5 months, while patients are achieving partial remission, it is around 4 months. Okay, and despite of this, 40% patients who have normal CA125 concentration, there can be still microscopic or macroscopic disease at the second look surgery. Is it clear?
Yes, sir.
Yes, sir.
So, yeah, so we finished the first topic of CA125 here. Thank you.